My most outrageous story, though, was I called 999 to get an ambulance to the house, and they arrived. Nothing was life-threatening, so they suggested I get a ride to A&E as opposed to them driving me. Triage was pretty outraged that the drivers told me to get my own ride. She made a comment something about them being on their phones and drinking tea and not wanting to pull a finger out. After 23 years being in the UK as an American, I've seen all sides of the NHS, of private healthcare, and today I'm sharing my personal experiences of the medical care I've received here, as well as comparing emergency care, routine healthcare, prescriptions, and also my ADHD and autism assessment and why going private for some things might be the only feasible option. So the first one I want to talk about is emergency care, because this is one that gets people in the US a lot, like in terms of gets them as it impacts them badly because it's so expensive. In the past 10 years, I've had 3 visits to the A&E, which is truly unfortunate. I also had 1 in the US and I've had 1 in the Philippines. Let's talk about it. I'd say there's quite a few similarities where you go to the entrance, there's a bunch of seats and you have to wait your turn and you get, you go through a triage process and the most, urgent cases get seen to first. US and UK is where I had the longest wait times. In the Philippines, I was a little bit more urgent because I had gastroenteritis. The only time I didn't have to wait was one time in England. I had sprained my ankle really badly the night before. I had my sister drive me there in the morning and they saw me pretty quickly. I was x-rayed and I think I was done in probably an hour. For the US and the Philippines, as part of the triage, before they start treatment, they need you to sign a waiver. And it's basically to say that you're going to pay the bill. In the US, remember them very clearly asking me if I had insurance, and thankfully I did have travel insurance. That meant they could just bill the insurance company as opposed to making me put the bill on my credit card or something. Whereas in the Philippines, the waiver, I said I would cover the costs. And she also asked if I had insurance, and I did. In terms of costs, the times I went in England, obviously no charges. However, US, that bill was probably about $15,000 US. And my insurance covered, I would say, like 95% of it. For the Philippines, I was hooked up to an IV and rehydrated, and that cost $275. And I'll talk about prescriptions separately, but I did have some follow-up prescriptions for both of those, which also cost extra. If you've ever had an emergency abroad and you had to go to A&E or whatever the equivalent is called, let me know in the comments below. And if you enjoy this video, I hope you'll give it a like and subscribe if you're new. It really helps. So before we get into the routine healthcare, I just wanted to talk a little bit about the difference between NHS and private. I think of the NHS as the safety net. Like, I will never lose my life savings because I can't afford to pay for medical care, which I find hugely comforting. However, it has its limits, and I'll talk about those. The advantage of private is that you can be seen for things and you can be seen more quickly. A good example is if you wanted to see a specialist. I've gone to my GP and, you can't just request a referral for anything you fancy. It doesn't work that way. I've had GPs say straight to my face, we can treat the symptoms, but we can't investigate the cause. So it's like, oh, okay. But that's where having private healthcare is a huge advantage. I don't have private healthcare now, but when I did, there were times when I was like, ooh, I should maybe get that investigated. A good example is I had an MRI. I don't think I would have gotten that on the NHS unless it became something that was like really, really impacting my quality of life, or if it meant I couldn't work or something like that. But for me personally, it was just a niggling, annoying thing that was kind of painful. And I thought this could turn into something that the NHS would have to treat, but let's just go ahead and see. In terms of getting an appointment, that can vary. That can take weeks sometimes to see a GP, which is kind of annoying. On the other hand, when I had private healthcare, I had an app where I could make an appointment to have a video call with a GP. And sometimes it was the same day, if not the same day, then the next day. Those private GPs also would process a referral within 24 hours. And there was no extra administration that you would definitely be facing in the US. Like I said before, GPs are really happy to treat symptoms, but they don't always have the ability to investigate the causes of things. If you want real answers, you'll need to somehow get a referral from them, or you'll have to go private. Referrals with the GP can take weeks or days. I will say though, there's been 2 instances where I found what might be a suspicious lump, and the GP was able to get me seen at a specialist breast clinic within a couple weeks. So, I mean, that's pretty fast. So yeah, it's like within the NHS, everything is really well integrated, and within private, it's really well integrated. Just a quick sidetrack. My first ever private medical experience was to have a small surgery on my leg. And I remember getting a letter, and it was signed by Mr., so-and-so, their name. And I remember thinking, first I was like, this must be a typo. Why is his title Mr.? And then I thought, well, maybe they don't let foreigners have like the real doctors. Maybe we're using like junior doctors. I didn't know. I was really young, brand new to the country. But when I met him, obviously, he was very calm and mature and very reassuring as a surgeon. So now I know surgeons don't use the title of doctor. Let's talk about preventative care because it's a little bit different in my experience. In the US, they tend to be a little bit more proactive about preventative care, which I suppose is the whole idea. For example, as a woman, you would get pelvic exams, pap smears every year. And here it's every 3 years. And I guess this is the key difference, is you're paying for it. I have noticed though with the NHS, after turning 50, there's a few more tests available to you. So they are proactive about letting you know that you're eligible for this, or you can, get that. Also, last time I was at the GP, she said, oh, it's been a few years since you've had any blood tests, so let's do that. Let's shift gears and talk about prescriptions. Everybody's favorite. My assessment of prescriptions in the US is it's a giant hassle, and it's very unpredictable. The costs change a lot depending on whether you're on a brand name drug or a generic drug. It can mean the difference of like several $100s. After I was discharged from my emergency situation when I was in the US, we went straight to the CVS pharmacy. It was one drug, and it was $75 for like a 1-week supply. Thankfully, I had my travel insurance that would cover it. In the Philippines, at the hospital, I had 6 prescriptions that were recommended to me, and it cost about £100 for all 6. I know that prescriptions are free for everybody in Northern Ireland, Wales, and Scotland, but in England we pay, and it's a flat rate of £9.90 per prescription per drug. I remember being very confused the first few times the pharmacist would ask me, do you pay for prescriptions? I was like, what? Yeah. I didn't know there was another option, but it turns out it's true. Depending on certain health conditions, or there's probably other factors, some people get free prescriptions in England, but I'm not one of them, so I pay. However, not that long ago, they've started introducing something called a prepayment certificate, which is a annual pre-purchasing of prescriptions. And I just know for me personally, I get HRT. It's just under £20 for the full year. Without that, I'd be paying 4 times more. So it's super duper worth it. And I know that they have other prepayment certificates that covers all prescriptions, but for me, I'm on that one for now. Yeah, so ADHD and autism assessments. I haven't spoken about them on this channel. Let's just put it this way. Hormonal shifts in the body, and I'm going to put perimenopause as one of them, can really bring about cognitive changes and how we experience the world. And after I got my HRT, I could see that I'm still struggling with some of the same things. I was hoping HRT would be this magical solution, but it wasn't. So I thought I would just get an ADHD diagnosis and see if that was what was going on, because I was starting to suspect it might be. And the waiting lists for the NHS are ridiculously long. And in fact, I think they're getting longer because as awareness builds, there's a lot more people thinking, actually, that might be why I've been struggling. So I paid for a private assessment. I think I paid maybe £900, which is fair amount of money. At the time, I could afford it. I tested positive for ADHD. After a while, though, I realized that the ADHD diagnosis didn't explain everything that I was going through and struggling with. So I thought maybe I needed to get the autism diagnosis. And thankfully, the private medical care I had through work actually did cover that. So I didn't have to pay for my autism diagnosis. If anyone wants me to make a separate video going a little bit more in depth about that process, I'd be happy to. Just let me know in the comments. In terms of the NHS, I'm very, very, very happy. Very happy. I didn't go into like every single experience, every detail, but overall it's been incredibly positive. I've had really positive interactions with everybody who works in the NHS. And I think of the NHS as my safety net. And it's one of the major reasons why I don't think I could go back and live in the United States, because I'd be so worried about not having health care. It's not something I want to just roll the dice on. I did it when I was younger, and I just think like now that I'm over 50, I don't want to do that. So happy I became a citizen. If you want to hear more about my experiences living in England, please hit that subscribe button. And if you enjoyed this video, give it a like. I'm not currently working full-time, but if I go back full-time, hopefully I'll also have private healthcare again. It's hugely cool to have that option. And honestly, I'd rather go private and leave space in the NHS for someone else to use that. I hope you'll stick around for the next one. You can watch this one next about some cute little quirks about British homes.